Hello, I want to share some thoughts from this book, Positive Health, Health Beyond Pills. This is a book that is meant to help us adopt the well-being concept of health. There are two approaches to ensuring your health and longevity. One of them is to emphasize the disease concept, where we are looking at the origin of disease or the causes of disease, the mechanism of disease, the symptoms they produce. We are able to diagnose them, find antidotes to them, and by so doing, we can eliminate the disease and eliminate symptoms, or we can control the disease where elimination is not possible to minimize the symptoms or to prevent some complications, to ensure good health and to prolong life. So then the focus is on when you fall sick, they are going to take care of you. That is seen more as a more negative approach to providing healthcare. Then we have what we call the more positive approach, which is the well-being concept. That is looking at the overall well-being, mental, emotional, and physical. And we are looking at all the health assets, or what we call the salutary factors or health habits that when we promote or when you engage in, you can live healthy, you can live happy, you can live long. So the well-being concept is looking at not just managing disease, it includes management of disease. You can't be talking about well-being when there's a disease, there's an infection, somebody is suffering some pain or some discomfort, and then you are not treating that with medications or surgeries. The well-being concept involves managing disease with medications, with surgery, as well as looking at all other factors, psychological factors, environmental factors, social factors, social support, and many other things that can contribute to the overall well-being. For instance, the concept of studying centenarians or people who live 100 years and above is to find out beyond taking medications and performing surgeries, what else accounts for people living longer and living healthier. And one of the popular concepts that try to look at some non-drug factors that contribute to good health and longevity is the blue zone concept, whereby there's a belief that there are some people living in some geographical areas that were found to live longer and healthier than other people belonging to other geographical areas. This blue zone concept is popularized by one American author and journalist, Dan Buettner, who got interested in some geographical areas where people lived longer in their 90s, and you find a lot of centenarians, people living 100 years and above. And one thing that fascinated him was that these people were mentally and physically functional. So ideally, when you are aging, you should have some age-related problems, sometimes like some mental health problems that are associated with old age, like dementia or delirium. That can affect your memory, can affect your thinking ability. You can be talking to people and your words don't add up. You are confused in your conversation. You can not recognize people because of old age. You cannot remember certain things because of old age. But then Westner realized that these people living in these blue zones were mentally functional. You could converse with them, you could remember people, remember dates, and so on and so forth. So then he thought that they should be doing something right. And that is why they live so long and healthy mentally and physically. Ideally, with old age, your movements are restricted or you cannot move too well. Your movements are slow because you are frail. You cannot do certain things. But you could see that these centenarians were able to carry out their day-to-day activities. Some are still doing their gardening, cooking their own food, going for their shopping, bathing themselves, washing their clothes, and so on. So mentally and physically, they were functional. So he was interested in finding out what is it about these people? What health habits have they adopted over the years that are non-drug factors that have resulted in them living long and healthy? Too many of these people were not on some medications and have undergone some surgery for us to see that their longevity was being sustained because of some medication they are on or some surgical procedures. They realized that Some have not developed even some chronic diseases. So it is not a case that they have a long lifespan, but they also have a long health span. That is, they're able to live long without disease or disability, or the onset of disease in these people are delayed. So the question was, what were these people doing right? And that's the question that he sought to answer. So there were some 5 salutary factors or health habits or lifestyle factors that he found common among these centenarians and people living in this blue zone regions. So he identified 5 blue zone regions: Okinawa in Japan, Sardinia in Italy, Nicoya in Costa Rica, then we have Icaria in Greece. Then he later added a place in the United States, that is Loma Linda, which is a place in California that has a high concentration of Seventh-day Adventists, that because of the practice of their faith or the practice of their religion, were practicing some health habits like avoiding some risky behaviors like smoking, alcohol abuse, risky sexual behaviors, and also adopted some vegetarian or vegan diets to promote their health and longevity. And the reason for the word blue is because he used a blue pen to mark these areas on the map and call them blue zones. So you found some habits or lifestyles that were characteristics of these blue zones. One of them is that you realize that they practiced eating plant-based diets and they were eating more whole foods. Whole foods are foods that are processed or minimally processed, so they are consumed virtually in their natural states. And when we talk about whole grains, for instance, we are talking about brown rice, wheat, oats, and they consume a lot of fruits and vegetables, nuts, some seeds, legumes like beans, and very little animal proteins. Aside eating plant-based meals more, and also eating less of animal proteins, some of them, like the people of Okinawa, Japan, were mindful of not overeating. So they practice this 80% full rule, whereby they eat slowly and they are watching out for satiety, so that once they are about 80% full, they stop eating. The idea is that they don't want to overeat. And we know that when you overeat, you add on calories that you don't need that can affect your health. So not overeating is also a very good goal to have when it comes to eating right. And the second thing that he realized about these people living in the blue zones is that they moved more, so they were engaged in a lot of physical activity. It's not like what you see in other parts of the world where you live a sedentary lifestyle and then throughout the week you from home you hop into your car, you go to work, you sit for long, and then you hop into your car again, come back home, sit down to watch TV, eat your meal, sleep. You do that for the whole week and you hit the gym on weekends. That is not how it was for them. For them, their physical activity was not about having a gym membership or workout at the weekends. It was built into their day-to-day activities. So they moved more because of the work they do. They have to go to farm, gardening, and going to the shop, and many other things that they do does not involve having to sit down for long, but allow them to move a lot more. A third finding was that they had a sense of purpose. So they have something to wake up to. They have a reason to live. They have a positive outlook on life. So it gave them some satisfaction, fulfillment, some peace of mind. So with that kind of um, optimistic look on life, that kind of having a positive mental attitude, it helps them cope better with stress. Once you're enjoying mental well-being, you're likely to enjoy physical well-being because of the mind-body connection. So they had a positive outlook on life. They they had this sense of purpose and practice contentment with what they do, content with what they have and who they are. And then they always had this positive outlook on life. Then a fourth factor that was observed about them was that they practiced social connections, positive, healthy relationships. So they are people that they can enjoy their lives with, they can enjoy events, ceremonies with, and they have people that they can count on in times of need. So we know the importance of social support. social capital, having family, friends, having community, people you can count on in times of need. If you are not well, you need somebody to take you to the hospital, to bring you food, cook for you, take care of your children, so you can have peace of mind. And that's also gave them that sense of belongingness, which of course is very important for your mental well-being and your physical well-being. And that is to say that the opposite, which is having a false sense of belongingness, and negative relationships can also affect your well-being, your mental well-being, emotional well-being. So it is good that you build community that help each other and encourage people to have that sense of belongingness. And that's usually is possible when you treat people based on their humanness, which we all have, rather than based on a stereotype. Then the fifth thing that was observed about them was that they are able to cope very well with stress. Most of them have survived the World War II, and so they have gone through stressful moments. They have the capacity to manage stress and deal with stressful situations. They have the resilience against problems, challenges. There are also people that are not in a hurry, usually. They don't live a fast-paced life. So it means they are more relaxed, and so it can help them prevent stress and manage stress properly. So these were the five things that were observed with the blue zones and these old people that were living in their 90s and in their hundreds and above. So they practiced plant-based diets mainly. They moved more, that is engaged in physical activities. They had a sense of purpose that gave them a positive outlook on life. They practiced community or social connectedness, and then they also know how to manage stress and reduce stress. Based on other findings or evidence-based approaches that are out there for promoting health and longevity, for instance, WHO encourages that you should avoid risky behaviors. So number 6, you have to avoid risky behaviors like alcohol misuse and smoking, the use of some hard substances. Then number 7, you must do medical checkup, especially because there are diseases that run in the family. So if your father has a prostate disease, you have a high risk of getting prostate disease. And with prostate disease, for instance, and some cancers or some other chronic diseases, early detection helps to manage them. If you have a prostate disease and it's detected early, you can be managed early enough so that if it's a cancer, it does not spread to other areas. So medical checkup helps to detect the hypertension, the diabetes early, the breast cancer early, the prostate disease early, and so on, and manage them to prevent complications along your health and to help you live long. Then number 8, you must also take your medications. If you have hypertension, you have diabetes, this is not the time to be saying that, well, you want to practice the lifestyle of the blue zone people who are not taking these medications maybe, but they are living long and healthy. You have hypertension, you have diabetes, so you need medications to control them so you don't get to have complications like a stroke, a heart disease, and so on and so forth. And so diseases, when present, they must be treated, as well as the lifestyle modifications that are needed. So basically what I've said is that there's a disease concept to health and there is a well-being concept to health. So in this book, we advocate the well-being concept to health because it incorporates the disease concept, which is managing disease with medications and with surgery. But at the same time, also it encourages some other factors that can ensure your well-being mentally, emotionally, and physically. For instance, what is practiced at the blue zones? If you add them to managing disease with medication and surgery, then you are going to realize that it is easier to achieve good health and longevity than if you were just focused on managing disease alone. So that's the concept in this book. Let's not just focus on managing disease alone, but let us also explore all other methods of promoting good health so we can ensure well-being mentally, emotionally, as well as physically to ensure good health and longevity.